Isabella was the first transgender child I cared for in my medical practice. I've changed the details of Bella's story to protect her identity, and this photo is not actually a picture of one of my patients, but she could be. This is what my patients look like. They look like people, sometimes like little kids. I'm Dr. Carolyn Wolfe-Gould, a family physician from Oneonta, a small town in rural upstate New York. I started working with transgender patients in 2007 when a transgender man moved to the area and asked me to take him on as a patient. Like most doctors, I said, "So sorry, I have no training, no experience." But this man insisted. He said, "There's nowhere else I can go for care." And he offered to provide me with resources to learn what I needed to know. Bella came about 3 years later. By that time, I was caring for a handful of transgender adults. I'd also started working with a therapist, Loretta, who was training me in cultural competency. Loretta called me on the phone. "Hey, I need your help with a kid," she said, "a 5-year-old with a single mom. I've never met anyone quite like her. Isabella, Bella for short. She was assigned male at birth. She's a little bit of a thing with a mind the size of Manhattan. At our first visit, she walked into my office alone while her mother waited in the lobby. After I asked how I could help, she looked straight into my eyes. 'I'm here so you can help my mom,' she said. 'She's having a really hard time with my gender.' 'Oh,' said Loretta, 'tell me more.' When I was born, my mom thought I was a boy because I had a penis. But I'm not a boy, I'm a girl. But people say things to my mom, and she gets upset." "Are you upset?" Loretta asked Bella. "No. Well, yes. But just when my mom is upset, and when the police came, I didn't like that." "How do you know you're a girl?" Loretta asked. Bella looked surprised. She shrugged. "Because I know. I've always been a girl." As Loretta dug deeper into Bella's story, she learned that it was Child Protective Services, not the police, who came to Bella's home. One of Bella's teachers had reported her mom for, and I quote, "making her son wear dresses to school." It was causing problems, the teacher said. Even the other kids think he's a girl. Because of this complaint, Child Protective Services threatened to remove Bella from her loving home. Loretta did some trainings to educate the school. Bella was now attending kindergarten and doing well as herself. Loretta asked me to be Bella's doctor. "She needs immunizations," she said, "and well child checks." Me? My doctor brain started to tick. I had no training or experience with transgender children. How could I possibly be a physician for Bella? But another part of my brain started doing this thing that it does when a patient asks me for help and I don't know what to do. I asked myself, what if this were my child? Because that's what it boils down to for us doctors a lot of the time, when we don't know what to do, how to respond, which is often we ask ourselves, what if this woman on the vent were my grandmother? What if this were my child? Loretta continued. Someday, Bella may need something more from her doctor, but who knows? She's only 5. The family needs an affirming doctor, one who will listen. Isn't that what doctors do? They pull out their stethoscopes and say, "Let me listen to your heart." I looked down at my neck. That's where I wear my stethoscope. "Do that," Loretta said. "But remember, your stethoscope is only a prop. Let me listen to your heart." I'm going to back up a moment and tell you a little bit about myself and my background. I'm a cisgender woman. I'm heterosexual, white, married, and the mother of 3. I went to college, medical school, and I did my residency in family practice. And along the way, like most doctors, I had no training about how to help patients with gender issues. Lots of privilege, right? White privilege, heterosexual privilege, cisgender privilege, class privilege. How does someone with my identities, all of my privilege, and my lack of training become a good doctor for Bella? It's not enough to say, let me listen to your heart, if I don't get it, if I don't understand what it's like to be a Black transgender girl in this world. With few options for training, I went instead to places where I could talk and meet with transgender people. Networking conferences, support groups. I asked a lot of questions. I listened to many stories. I found a safe place for my questions in the transgender community. I changed, I grew, not just as a doctor, but as a human being. I learned that transgender people face relentless discrimination in all walks of life, including employment, family life, housing, education, public accommodation, but that some of the most appalling discrimination happens in healthcare settings when they reach out for help. Consider for a moment the last time you reached out for help. Were you sick? In pain, perhaps? Were you suffering? Were you sad? Were you vulnerable? What do transgender people want from their healthcare providers? It's quite simple. Like everyone else, they want their clinician to be knowledgeable and competent about their healthcare needs. They want kindness, and they want to be affirmed in their experienced gender. What do they get? Often, they are greeted instead with confusion, disgust, suspicion, or ridicule. This from the staff in the emergency room, from their therapist, or their doctor. The inability of transgender people to access affirming health care is considered a wicked problem. Have you heard about wicked problems? This is a simple problem, a leaky faucet. You see the drip and you call the plumber, or you go to the hardware store and buy a gasket and fix it yourself. A leaky faucet is relatively easy to fix. This represents our wicked problem. How can we provide affirming healthcare for transgender people from our little town, our little clinic in upstate New York? By definition, wicked problems don't have simple solutions like leaky faucets. They are complex, systemic, malignant, and they inflict great pain and suffering on individuals and communities. Every time we approached one of the many barriers to care faced by our patients, we discovered an entirely new set of roadblocks, each requiring urgent and consuming attention. Does it make you tired to look at this slide? All those squiggly lines, exploding arrows, chaos, confusion. It made us tired too, but we did the work anyways and created a gender wellness center and an interdisciplinary team. Our team includes social workers, nurses, surgeons, psychologists, researchers, legal advocates, and medical doctors like me. We have cared for over 1,000 transgender people from our small town family practice. And like me, my team members have all gone through this process of listening and learning in order to serve our transgender patients well. Let me listen to your heart. I'm going to tell you the most important things that we have learned. Gender, male and female. This is what most of us were brought up to believe. There are 2 bathrooms, 2 choices, right? But actually, gender is far more complex. It's made up of at least 4 different components, which all exist on a spectrum. The first is sex assigned at birth. When a baby is born, everyone looks and says, it's a boy, it's a girl. But some babies are not clearly one or the other. They have ambiguous genitalia, an intersex condition. Even sex assigned at birth exists on a spectrum. Gender identity refers to the internal perception of one's gender, the maleness or femaleness one feels inside. Usually, gender identity is congruent with one's sex assigned at birth, but not always. What do you feel inside? Masculine? Feminine? Perhaps something in between? The third component is gender expression. This is how we wear our gender. Look around the room for a moment. Every one of you is telling us something with your expression of your gender. Look at haircuts, look at glasses, look at clothing, look at shoes. Masculine? Is it feminine? Is it something in between? The expression of gender may or may not align with one's gender identity or one's sex assigned at birth. The fourth component is sexual orientation, the direction of emotional or physical attraction. Homosexual, heterosexual, pansexual, asexual, something else. Each of these four components of gender exists on a spectrum and are not necessarily linked. If I hadn't just told you about myself a few minutes ago, which of these things would you know seeing me here on stage? Do you know my sex assigned at birth? You do not. Do you know my gender identity? You don't. Do you know my gender expression? Yes. Do you know my sexual orientation? No. Gender expression is the only one that you know just from looking at me up here on stage. And if clinicians don't ask, they won't know either, and they won't be much help to their patients. I'll tell you this. Once you blow the lid off of gender as a black and white binary, the world gets a whole lot more interesting. It starts to sparkle. It's a rainbow of color. We learned the definition of normal. It's just a setting on the dryer, honey. Our patients face discrimination and stigma outside of healthcare settings, too. It's hard to live well when you're bullied in school or at the grocery store, turned down when you try to enlist, unable to find a safe bathroom, or rejected by your family. People get beat up, even killed just for being who they are, especially transgender women of color like Bella. This stigma pushes people to the margins of society and leads to healthcare disparities, increased rates of depression, anxiety, HIV, and suicide. It's not enough just to care for patients within the walls of our office. As clinicians, we need to help build affirming communities where our patients can live safely. We have to educate families, train the cardiologist we refer to, coach the churches and schools. In order to provide our patients with affirming health care, we need to become agents for systemic change. We must serve as professional and political allies and advocates. We must work with our elected officials, meet with lawyers, change Medicaid law, and revise the policies in our own institutions to ensure that they are inclusive. Sometimes when we say, "Let me listen to your heart," we hear stories of despair, anger, or disgust from the family members of our patients. But sometimes, not always, those who have the hardest time accepting a family member are the ones who eventually become the biggest advocate for that person. So it's important for us to meet people where they are and to always listen with hope. We've also learned to sit with the stories of people who've experienced the unbearable pain of rejection when this hope fails to bear fruit. And we hear stories of courage. It takes great courage to let go of who the world says you should be in order to be who you are. The practice of gender medicine requires a different paradigm. Typically, you go to the doctor because you're sick, right? But these patients come to us looking for help finding authentic expression. They move from closed to open, from hidden to out, from shame to pride, and often celebration. As clinicians, our job is to watch people bloom. We have learned that one patient asking for help from an uninformed clinician in a broken system can plant the seed that drives that system to change. We started out with Bella needing her well child checks. Now we have a gender center and a team of clinicians. Our community and our administration helps us wrestle with our wicked problem. Colleagues and students ask us for training. The culture of health in our system is changing. We also learned another meaning for the word privilege. When doctors go into practice, we first apply for privileges at a hospital. If we pass the hiring criteria, we are granted permission to practice. We talked about privilege before, right? White privilege, heterosexual privilege, cisgender privilege. For years, I didn't understand why that particular word was used for this hiring process, but now I do. It means that, as clinicians, we are privileged by our bird's eye view into the lives of our patients. It's a privilege to listen to stories, to watch others courageously seek truth and authenticity. We bear witness to their journeys, their losses, their triumphs. And at the end of the day, we get to go home and consider our own lives and think about how we're doing with our own truth, our own authenticity. How am I doing with that? It's a work in progress. It's a privilege. I did take Bella on as a patient. She's 15 now. She persisted in her feminine gender identity. Our team worked to make sure that Bella's school and community could offer her a safe place to grow. Were we always successful? No. Bella was bullied in school. She suffered from anxiety and depression. The onset of a masculine puberty caused her excruciating discomfort. We learned how to use medications to induce a feminine puberty, one that aligns with Bella's gender identity and helps her feel more comfortable in her body. Bella is in high school now. She's doing okay. She just got a lead in the school musical. She plans to go to college and become a therapist. And finally, we learned that the process of truth-seeking, of transformation, is contagious. As clinician, this truth-speaking spreads to us too. While bearing witness to our transgender patients as they question, explore, and find their authentic expression, we are moved. We too pass through a transformative process that in some small way mirrors that of our patients. Those of us doing this work all know this. I have yet to meet a clinician for transgender people who isn't passionate about their work. Any one of you can be truth seekers and allies too. You who are teachers, faith leaders, elected officials. You, the ones who bag groceries, the ones who pump gas. You can connect, respect, listen, learn, and then you can go home and think about what searching for authenticity means to you too. Let me listen to your heart. Who will you be when you let go of who the world says you should be in order to be who you are? May we all have the courage to listen and to speak from the heart. May we all have the courage to bloom.